Yeah, I'm Brendan Fisher from the World Wildlife Fund and the Conservation Science Program at World Wildlife Fund in DC. And our succinct proposal aims to look at how natural resources, land use change, and natural resource management affects social welfare and health. And so what we're thinking about, this is built on work that we've already done, but we can think about at least three ways in which the natural environment affects human welfare. And mainly our focus is on developing countries. So we're looking at marginalized and poor people, mainly in sub-Saharan Africa, but also coastal tropical areas. So we can think about how the governance of natural resources affects human welfare. If you exclude people from protected areas, they can't collect firewood. If you exclude people from fisheries, they might not have access to protein. Likewise, you might think of governance regimes which actually aid social outcomes, such as allowing people to harvest wood, chop trees, etc., but might have negative impacts on the environment which is sustaining them in the first place. We can also think of general land use change or climate change trends which might affect their social welfare. So the third one is actually really a subset of the second one, in that we can think about land use change that might happen naturally via storms or climate change, but also the human feedback. So as humans deforest or as humans expand their agriculture, it might have these feedbacks on both the ecology, the system functioning, and the social welfare. So our project aims to look at that, and we're excited about it is because a lot of these studies have been done on that case study level. So we can think about going into an individual protected area or going to a coastal reef and seeing how it's managed and seeing how the certain management or the condition of that natural ecosystem or that managed ecosystem affects both the biodiversity or the ecology of the system, but also the social welfare. The problem with the case study approach is that we can learn a lot about one place, and that's really important, and it really provides context. But in this world of both rapidly changing environmental condition and social condition, with over 1 billion people who are food insecure, we might need to augment those case studies with a larger scale assessment where we might not know a ton about one place, but we might know some important things about a lot of places. So in today's world, we live in a world of big data, and there's lots of data out there, and a lot of it is freely available. So our project is trying to look at this relationship between household welfare, human health, and natural environment conditions, processes, and governance in a way that takes advantage of these big data. So we can collect big data sets like deforestation layers, climate variability, and vulnerability layers. We can think about large data sets which we have access to, household surveys. So the World Bank has a living standards and measurement survey which is freely available and GPS referenced. Similar to the USAID's demographic and health survey. 90 countries are covered in this survey over several time periods. Some of those surveys have biomarker data, which means they're going out and actually pinpricking people, testing their blood for things that actually have a environmental vector like anemia, and we can think about bushmeat and fish protein, things like precursors to malaria. So these things are being collected in a way which the health and demographic folks consider the gold standard. These are biomarker, real biophysical data, not simply survey questions. And we can combine those with these larger scale freely available data sets that relate to natural resource governance, like protected areas and community-based forest management, and also to models that look at future changes of the landscape and how that might modulate both the ecological processes and therefore the human welfare. So one of the things is that this social kind of conservation development interface is often considered a tough problem or a wicked problem because a lot of it is untractable. And we're really excited because we've done this on the small scale and the national scale, trying to bring together these data sets to make that wicked problem more tractable. And we think that with the help of this succinct workshop, we'll be able to look at it maybe pan-tropically or globally.